is Rhea. I lead strategy and impact at Wysa. We're a mental health tech company. And one of the things that became evident to me very early on was that mental health is everywhere. it's it's indeed a human right, but the more you work in education, agriculture, gender, no matter where, it's impossible to not come across mental health as an intersectional lens. A personal AI chatbot can act like a personal coach that just resides on your smartphone in your pocket 24/7 for free. It feels like you're speaking to your friend, but it also actually is able to give you the right psychological techniques, the right skill based solution to actually help you get out of something that you're going through. And that's the power of AI and that's the power of technology, which actually makes sure that someone has not only access to a tool like this, but that tool itself is clinically validated and effective, much like actually meeting a human therapist. We've done research that actually shows that people open up to an AI chatbot 3 times faster than they would to a human therapist. The idea that something like AI can complement the existing mental health professionals and therapists around the world is what's needed. The idea is never to replace therapy. The idea is never to replace mental health professionals. But how can we make sure that every single human being has the awareness and has the access to actually be able to seek help? Mental health actually manifests in ways that are typically invisibilized or in ways where it's even hard for one to identify it for their own self. There is a lot of evidence that says that it's just the act of speaking to someone and confiding in someone can actually reduce a lot of our mental health concerns. Most people in the world actually don't have that, particularly when you think of anyone who's underserved or marginalized. This idea that you can have a space where your feelings matter, a space where you can process your thoughts, is actually really, really privileged. How can we ensure equality in terms of just this basic human need for connection? Just the idea that there is something accessible right where you are in your home, inside your smartphone, is powerful in itself. It needs to be cost effective. And an AI coach that can do that is free. It needs to be contextual to you. And what we've done with Wysa is we've actually made sure that it's in the language that the woman speaks. Even for people who speak English, it's not necessary that they feel in English. And I think that's a really important insight for us is something like mental health really needs to be met with where the users are. What I do at Wysa is essentially figure out how do we take this fantastic technology that we've built over the last many years and take it to the people who would never have actually found us. And I think for me, adolescent girls, young women, indeed close to my heart. And I think working with this population makes it really gratifying. The amounts of systemic oppression, patriarchy, and just in general biological bodily changes that young women go through really puts them at risk of a lot of unchecked and unsupported mental health challenges and trauma in their life. And particularly for women going through the maternal journey, it's in itself is already such a huge toll on one's physical and emotional well-being. Support for a mother or a young woman in a maternal journey has to start much, much sooner. It's an entire spectrum of, at the adolescent age. And from there to go on to, becoming a whole individual self. And if, one chooses to actually become a mother. And so I think mental health support actually needs to be very holistic when we think of women in terms of their journey, right from adolescence and at a young age to post giving birth. To actually provide mental health care support, you need to invest in someone's inner life and journey over the years. One example is, negotiation skills for adolescent girls, for instance, is one of the foremost ways in which at Wysa we try and support adolescent girls, because negotiation skills really allows young girls to navigate family relationships, difficult life circumstances. That's the power of early intervention that can make mothers more capable and their children healthier. I think what I really care about, having lived through depression myself and having lived experience of mental health challenges, one of the things that I feel very strongly is that I think no human being in this world should feel lonely. And I can't wait to see this actually scale to millions and millions of more adolescent girls and women, because I think that's how we change the world.